Hey everyone! It is a gorgeous evening here in Wisconsin, and I thought I would come out and sit on my deck and talk to you all. So, I was talking with a friend the other day, and she was telling me how her doctor has said he's never seen anyone lower their A1C or reverse type 2 diabetes without medication, and prescribed to her for diet wise that she needed to eat X amount of carbohydrates per day and then X amount per meal, and prescribed insulin. She doesn't want to be on insulin. Insulin makes her gain weight. And it kind of got me to thinking, this is a common problem with doctors not realizing with nutrition and how we can heal ourselves with nutrition, because food is medicine. You don't need to throw drugs at everything. So often we can heal ourselves or make things much better with food. Food is the medicine that God gave us to heal ourselves. We're sick because of food, not because of the food God gave us, but because of the frankenfood that big food has given us. All the processed carbs, all the GMO foods, all the oversweetened fruit, because the fruit that we have now is not the same fruit that we had 100, 200, 300 years ago. It's bred to be much sweeter, so much higher sugar content. But it got me to thinking that maybe I should do a video on what to say to your doctor and what not to say to your doctor when you go in. So I thought I'd just give a few tips. Now, if you're like me, where I haven't, up until this past February, I hadn't seen a doctor in 5 years. I haven't really had a need to outside of my chiropractor. My kids, would go for their 1 year checkup, or if they, would get sick enough that they needed to see the doctor. And then on the flip side, you've got someone like my husband who's a type 1 diabetic, so he has to have an appointment every 3 months. And, so I don't see a doctor that often. He has to see a doctor, have lab works and whatnot. And then, so everyone is in some sort of spectrum. If you're like me, where you don't have to see a doctor that often, you go in and get, a physical once a year, maybe because your health insurance requires it or work requires it or whatever, the doctor may or may not ask you about your diet. How do you eat? So here's what not to say. I eat keto. I eat zero carb. I eat low carb, high fat. The doctor is going to hear that, and they're going to put up this block, and they're going to tell you that how you're eating is dangerous. You're going to kill yourself. You're going to raise your cholesterol. Just unless you know that your doctor eats that way, or maybe they brought it up to you, in my humble opinion, it's best not to even say that. So how do you tell your doctor, should they even ask, about your diet? Especially if you end up, having cholesterol labs drawn or something like that, and you might have an elevated LDL, but your HDL and your triglycerides are beautiful. How do you not lie but not be confrontational. This is what I do, and this is how I did for when we switched my children's doctors. Is, when they asked, especially for kids, they'll ask, are you eating well? Do you eat all the food groups, right? So our standard answer is we eat 0 processed foods, and we eat all whole foods with the focus on protein and good healthy fats. I didn't say I was carnivore. I didn't say that I ate 0 carbs. I didn't say keto. None of that. And it was all completely truthful, because eliminating processed foods, that means eliminating, breads, pastas, rice, cereal, cookies, chips, all of that. If you say I focus on whole food, 1 ingredient foods, you might have some fruit every now and then. My kids like berries, and I let them have them. They make a lovely dessert with some homemade whipped cream, and there's nothing wrong with that because they're metabolically healthy. But it still is not processed food. So that is the best answer that you can give. When you go labeling off a different diet, you're setting yourself up for confrontation. Now, let's say that you have a medical condition that makes you have to see the doctor more frequently. Maybe you're on medication and you'd like to get off the medication. So you go to your doctor, and you have the option of, hey doc, I want to get off this medication, whether it's blood pressure medication or cholesterol medication, which please never go on a statin ever. There's really no reason, very little reason, and the side effects of those are way worse than any benefit you might get from the statin. But number 1, you don't need your doctor's permission to eat any one way. If your doctor says, or your dietitian, that you need to eat X amount of carbs each meal, and you need to have a snack in between, and I'm going to give you this insulin. Okay, this is what got me thinking, why not just remove the foods that are causing you to have the insulin? That is what makes the most sense. If that freaks your doctor out, just don't tell him. And then just say, I've been monitoring my blood sugar, and I notice as long as I eat whole foods, I'm not needing to take this insulin. So I want to get off of it. Or I'm having lows now, a lot of lows. So please help me lower this insulin. If they're just completely adamant because you're an uneducated patient, my best advice then is to not be confrontational unless you're like me and it doesn't bother you, because I'm going to advocate for my own health, and that's what you really need to do, is advocate for your health. Don't be afraid to tell the doctor, no, I don't feel good when I eat carbohydrates. So I am not going to be eating that amount of carbohydrates. And any carbohydrates that I get will be from small amounts of fruit and vegetables. They are not the ones that have to live with the side effects of elevated blood sugars, of elevated cholesterol. They are not the ones that have to live with the side effects of the medications that they put you on because of their bad advice. Now, I am not bashing doctors, okay? Don't take that as... Doctors get such little nutrition in college, in all their years of medical school. What they do get is drug knowledge. That's all they know. So unless you have a doctor that reads a lot of studies, and I'm not talking opinion pieces, but actual studies, and is willing to learn, then it's your job to either just smile and nod and do your own thing, and basically, like we have to do, because my husband needs insulin and he needs his continuous glucose monitor. So we smile and nod and then do our own thing. And then as you get the results and you're going back to your doctor and they're like, wow, this is great. See what my advice is doing. You can say, oh, actually, no, I didn't do what you said. This is what I did. And that's why my numbers are the way they are. And the more and more people that end up doing this, the more these doctors and nutritionists and dietitians are going to have to wake up and see. If you have a doctor that, wants to throw you on a statin, then ask for research. Or anything. Anything where they're like, no, you're gonna, kill yourself, or, you need this statin or you need this medication. Okay, doc, can you, now this is my example of for the cholesterol. Okay, can you give me these studies, the actual studies and the science papers that say this elevated LDL and this drug is going to help me, or it's going to prevent, a heart attack? And I'm speaking in the presence of low triglycerides and high HDL. They're not going to be able to give you those studies because there are none. But there are lots of studies, and more coming out every day, that higher LDL is actually immune protective, and that low LDL is actually detrimental. There are studies. And so when your doctor can't give you those studies, you can give them studies. Another option is, as you're dialoguing with your doctor, okay, doc, I understand that you've never seen this. You've never seen anyone get off their blood pressure medication or off their insulin. You've never seen anyone reverse their type 2 diabetes. Totally. I can understand that. Are you open to reading research that I bring you? And they're either going to say yes or they're going to say no. If they say no, they're jackwagons. And if they're just like completely anti-listening to anything that you've said because they think that you're just looking at Dr. Google, you may want to find a new doctor. At least one that's willing to be a health partner with you. You can agree to disagree, but they need to be your health partner. They need to help you achieve your goals, because ultimately you're the one that has to live with everything in your body, not them. They don't have to live with cognitive decline. They don't have to live with pain and inflammation. They don't have to live with weight gain from insulin that they're putting you on. They don't have to live with all of that. You do. I have found in my dealing with doctors who don't take me seriously, even though I am certified, I am a certified nutritional coach, that's not good enough for them. I didn't go to medical school. So they just roll their eyes and, yeah, whatever. And I have that happen even with friends and family that have known me, growing up and in all of my adult life. And they don't necessarily take me seriously because, oh, that's just Sherry, whatever. She doesn't have a college degree. She doesn't know what she's talking about. That's fine. What you need to do then, this suggestion, is to take yourself out of the equation and have your doctor review or read or whatever a peer. So another MD, another colleague, what would be essentially a colleague. And you can do that by getting books. And I always suggest that you need to read the research, read the literature, because you need to be educated and informed so that you can help educate and inform your doctor. And it doesn't mean you have to know everything or, whatever. That's why taking yourself out of the picture, out of that equation, so that you don't get accused of just regurgitating something from Dr. Google. So you go see your primary care physician, and they're worried about your cholesterol, or they have you on insulin. Okay, so this is what you can do. Okay, doc, I understand, but if I were to give you a book that went over what I'm saying, and it's written by a medical doctor, someone that is still in, practices, sees patients, things like that, would you please read it? And we can discuss at my next visit. When they say, yeah, sure, here's a few books. The first one, Lies My Doctor Told Me, by Dr. Ken Berry. He is a family physician, and he is in Tennessee. He has been practicing for over 20 years. And while I have not met him in person, I have met him over Zoom. Very smart doctor. His wife, Nisha, is actually a nurse. He wrote this book along with a lab book and a new book that just recently came out. This would be a good one to give your MD. Why? Because it's written by an MD. So it's a peer-to-peer person. Takes you out. Information is in here. And if you haven't read this book, I highly recommend it. You can also get it on audio if you're not a paperback type of book. But it's really good. Another good book, let's say you're diabetic. So, and not everyone who's diabetic has a endocrinologist. Well, how rude. Okay. Anyway, Dr. Jason Fung. He's a nephrologist out of Canada. He is a diabetic nephrologist. He has 2 books that I highly recommend. I don't have the other one out here with me. I thought I did, but apparently I don't. His first book is The Obesity Code, and that goes through all the science of fasting, of how carbohydrates cause insulin resistance, how to basically reverse. And it's not exactly a ketogenic book, but it really does go into a lot about the ketogenic diet. But it's all the science, the meat and potatoes of how your hormones work. And that's actually what brought me down this whole rabbit hole and got me to where I am now, is Dr. Fung's Obesity Code. Then if you're a type 2 diabetic, this is a little bit of a deeper dive. This is the Diabetes Code for reversing type 2 diabetes. So it goes a little bit more in depth with the diabetic. So the Obesity Code and then the Diabetes Code. If you have cancer or know someone that has cancer, he has a newer book out. I think it was written in 2020 or 2021 called The Cancer Code. And I just recently got that one, so that's I'm working through it because I've got a lot of books that I'm reading. So again, peer-to-peer. Now, yes, maybe you're not seeing a nephrologist, but that's okay. He is an MD, and what's in his books, your doctor can't deny. It should make your doctor take a deeper dive outside of what they've learned. So there's that one. Another one, Why We Get Sick. This book is all about insulin. The foreword was actually done by Jason Fung, by Dr. Fung, and it's the epidemic. It dives deep into most chronic diseases, how to fight them, and how we get to there, which most of it revolves around insulin and insulin resistance. This is a phenomenal book. I highly recommend you read it and give it to your doctor. Again, written by a doctor. Now, Ben Bikman is not a MD. He is a PhD, but he is a medical researcher. So he works with med students, and just phenomenal. So again, the science is in here, and it's all stuff that your doctor can't deny. What if you're a type 1 diabetic? So if you're a type 1 diabetic, you're never going to get off your insulin, but you can lower it, and you can lower your A1C. And if your doctor tries to tell you that you can't, or that you need carbohydrates and you just need to eat the carbohydrates and cover with insulin, Dr. Bernstein's diabetes solution. This is all about helping type 1 diabetics have normal blood sugars, and gives diet layout and everything. Dr. Bernstein was an engineer who was a type 1 diabetic. He was not taken seriously when he figured out how to control his blood sugar and how to lower his amount of insulin. He wasn't taken seriously by his doctor, so he decided to go back to school, became an MD and an endocrinologist, and then started publishing papers. He wrote this book. He has a whole YouTube channel called the Diabetes University. Dr. Barry also has a YouTube channel. And the reason that I'm telling you about Dr. Barry's is because you can find videos on almost everything. And then in the show notes of his videos, he often links the studies that you can then print and take to your doctor. Most doctors, if they're already got their minds closed, they're not going to listen to a YouTube doctor, but you can always suggest it. But I really think the literature and then printing the studies is going to be your best bet. If you're worried about, but if your doctor is all boo about the cholesterol, the books that I already recommended have loads of stuff in there. But Cholesterol Clarity, which is written by Dr. Eric Westman, MD, and if I recall, he works at Duke University and sees patients. So he has patients, has helped a ton of people. This book is chock full of so much information about cholesterol. It's insane. What if you have to meet with a dietitian? Because very often, if you're diabetic or whatnot, they will want you to meet with dietitians. The Dietitian's Dilemma by Michelle Hurn. I've done a book review on my channel, and but this is just a phenomenal book. And she's a registered dietitian, and she used to work in the hospitals, and she goes through like just how sick people are being made with the current guidelines. Great book to give your doctor or your nutritionist. Really opens their eyes. So there's that. And then one last one. Oh, and another one for cholesterol. I don't have his book yet. It's on its way here. Dr. Ovadia, who is a cardiac surgeon, wrote a book called Stay Off My Operating Table. That is a good one to have in your arsenal, because what better person to be talking about heart disease and cholesterol and all of that than a cardiac surgeon. So that's a really, really great one to have, and I'm looking forward to getting it and reading through it. There's so many books, right? I'm just trying to hit the ones that are written by medical doctors so that you have that peer-to-peer. if you are going through menopause or thyroid or any type of hormonal anything, Dr. Elizabeth Bright's Good Fat for Good Women is a great book. I am working, there's a lot of information with it, so I'm still working on it, but I've watched a lot of interviews with her, and very phenomenal. So she's in Italy, but she's a US citizen, so she's from Texas, if I remember correctly. But she sees patients like through Zoom and stuff like that, but she's based out of Italy. So this would be a good one for OBGYN, or even a PCP. So one other suggestion is, and this would be down the line, as your doctor becomes more open to learning, there are many, many conferences that are focused on low carbohydrate, ketogenic living, that actually count towards the medical continuing education requirements. So there was just one in March, I think is when it was, Low Carb Denver. Well, it was a 3-day conference, and I believe that you got like 13 CE credits for attending that. And what better way to be learning, and it's serious stuff because it's allowed to be counted as the CEs. So that might be something to bring up to your doctor. Yeah, I would just keep reading, and then never be afraid to ask your doctor for the literature. Well, give me the studies that say that. If let's say you've got Crohn's or whatever, and they want you to eat a lot of fiber, can you give me the studies that show that fiber really helps? They're never going to get back to you with it. There are studies that show that you shouldn't be having fiber because it actually makes things worse. So those were just the things that were, kind of rambling through my mind. Just remember, you are always your health advocate. You don't need your doctor's permission to eat any one way, and you do not have to eat the way they tell you that you have to eat, especially if you don't feel good with it. You do you, and try to educate them along the way. You don't need no one's permission. So I hope that you found some of my ramblings helpful. And maybe next time you're in your doctor's office, you'll think of me. Thanks. Have a good night.